Hi, my name is Jessica Altamara, and I am head of infant feeding for the North Carolina Integrative Tongue Tie Center. And I want to talk to you today about something that I call prehab. It's like rehab, but before. And the reason that I want to talk about this is that a lot of people are in that middle ground between when they have a diagnosis and when they have a tongue tie or a lip tie, and when they have planned treatment. And this time frame is a great time frame to prepare for your baby having treatment, and more importantly, to prepare for the time afterwards when they are healing from the procedure, when they're integrating the change of having their mouth changed, and in finding the smoothest possible recovery period for everyone involved. What we have found over the years is that there really are a lot of things that can be done ahead of time to be better prepared and to feel more confident during that time frame. So if your baby is being treated through the North Carolina Tongue Tie Center, then you will have the benefit of a ton of information on the day of treatment and hand holding and support following that. But leading up to that, there are several things you can do to be prepared. There are some ideas that it's really helpful to understand. And the biggest one is that for a baby, they really do a lot of experiencing the world with their mouths. And so when we change a baby's mouth, that's a pretty big deal for them. And that can really take a lot of kind of updating. The way that I often put it is that when your baby has their tongue and or lip tie released, that's like a major hardware change, but we also need their software to update. And in helping their software update, we want them to be in the best possible place for experiencing change. So I'm going to go chronologically through what is helpful for afterwards. But before I do that, I also want to talk about what you can be doing now besides kind of getting a lot of the products. So in the description for this video is a link to an article that talks a lot about products and how to use them post-op. These are things that you may want to go ahead and have on hand, and that will be helpful. I'll talk about them a little bit more in a minute, but it's also important to understand leading up to this that there are things your baby will be experiencing post-op and you can help them be prepared. One of them is discomfort. We have every reason to believe that there is not a lot of pain following the procedure, but there is discomfort the evening of. There is some pain the evening of. Beyond that, we're also doing active wound management, which involves having your fingers in your baby's mouth and helping the wound to heal properly, just ensuring that things are going to go in a predictable way with wound healing. And that is irritating. The analogy that I often use when talking about active wound management is that it's like diaper changes. And often when we change babies' diapers, they can have really big feelings about it, especially when they're really new. And with a 2-day-old baby, you might think you're hurting them when you change their diaper because they can get very worked up. But we know we're not actually hurting babies when we change their diapers. It helps to remember that, like diaper changes, these stretches are something we do for babies, not to babies. At the same time, they can have pretty big feelings, and getting good at co-regulation is an important skill that will really help with post-procedure and doing that and comfort measures and everything. What I mean by co-regulation is that we're in a feedback loop with our babies. And especially when we're holding them, but at all times they're feeding off of us. So if they're upset and they're escalating, they're getting more frustrated, they're getting more upset, and we are escalating with them, then that kind of leaves them feeling like they should be getting more upset, and it builds, and we end up with this cycle of everybody getting more and more worked up. But if we work on sending signals to babies that they are unhappy and they are uncomfortable, but they're safe and we're not scared, then that really helps them to be no more than irritated. Over time, we get this way with diaper changes, right? When we're first changing babies' diapers and they're having really big feelings and we're rushing and we're changing and we're getting really worked up with them. And then we all have to calm down. And then after a little while, we still care that they don't like having their diaper changed, but we're okay. I know. Yes, you're okay. All right, let's calm down. And practicing that skill is really helpful. So, you've already been practicing it with the analogy that I just gave you. But being intentional with building those skills is helpful. Another place that we can work on building those skills is with play and with tummy time, rolling babies onto their tummies and staying with them and being engaged in that process. And then when they start to get frustrated with different things that they're working on their tummies, kind of talking to them and giving them a chance to work it out, noticing how often they do work it out. And then when they really aren't going to work it out, rolling them back out onto their backs and picking them up, helping them take a reset, then doing it again. Immediately going back into rolling them, putting them on their backs, rolling them to their tummies, letting them really start to get worked up, not freaking out, but giving them a chance to work things out and get frustrated. And when they're frustrated and it's clear that they're not going to work it out, rolling them back out, picking them up and taking a reset. So moving into frustration and resetting through connection, moving into frustration and resetting through connection helps your baby get better at calming down when they're uncomfortable or frustrated. And there's definitely plenty of frustration and discomfort following their mouth changing. It's tricky anytime our bodies change. So if you've been pregnant in the process of having your baby and you've noticed your body changing, and it can be frustrating, and then you kind of have to learn to integrate how your body changes through the whole process of pregnancy and birth and postpartum. And it's similar to that. Anytime our bodies change, we really have to integrate that change and start to feel like ourselves again. So helping your baby get good at dealing with change is very helpful. The best way to help them get good at dealing with change is to help them learn to start finding their body in space and exploring the world. So the more time your baby spends swaddled or in what we call containers, so that's like swings and bouncers and dockatots. Anytime, they're kind of in this like thing that helps them go into a fetal position, even something like the SNU that really kind of like restricts their movement. These are all containment of some kind, and it can be comforting, and babies let us put them down for longer with that because it does have a more womb-like feeling where they don't startle as much. But they're also not integrating change and the change of being born and being out in a bigger world. And so really helping them spend a lot of time being worn on your body, lying on their backs and their tummies on firm, flat surfaces, playing with them, helping them move in a variety of ways, holding them so that they can arch back like this and really stretch out all of those tongue muscles that might be tight. These are all things that will help your baby be in a place that when their mouth changes, and especially if their mouth changes and then it's a little bit sore on and off, they often have sore muscles in the first week post-op, that they're able to deal with it, and they're less likely to say freak out or shut down, or both, in that time afterwards. So we see babies handle aftercare better. We see babies less likely to have trouble wanting to eat in the day after the procedure. A lot of parents do have concerns that their babies are going to refuse to latch or refuse to eat, or that they won't be able to handle doing stretches and then they won't get healing. And those are some things that are legitimate concerns. Doing all of this practice ahead of time really helps prevent that in large part. The evening of can still be a struggle, however. So we start with this prehab, and that is helping your baby practice being uncomfortable by letting them get frustrated and then reset, and then frustrated and reset through play and through connection. It doesn't really help them to do it by themselves, like to cry and then calm down. It helps them to do that in co-regulation with us. So playing with them, but letting them really work on a new skill until it's clear they won't work it out, resetting, doing it again, resetting. That helps them practice upregulating and downregulating, because that's a skill, and all skills get better with practice. So when your baby has a chance to practice downregulating, it helps them get better at it. But as you also practice supporting them in downregulating, your skills in doing that will be better as well. Another thing that helps a lot is just tons of eye contact, because that's something that doesn't happen in the womb. So we want lots of movement, lots of holding and wearing them while you're moving, lots of time on a firm, flat surface, lots of connection, and lots of eye contact. These are all things that really help ahead of time. The last thing that we've seen make a huge difference in how well babies do with aftercare is to have them used to having fingers in their mouth and movement of their lip and their tongue. These stretches that you're going to learn on the day of treatment are also really important to do, but probably the thing that most people find to be the most intimidating and the hardest, and you can practice them ahead of time. So it really helps for everyone if you're practicing as much of what happens with stretches ahead of time. Babies get used to having fingers in their mouth. Parents get better at getting their fingers in babies' mouths, getting under lips and getting under tongues. And those are kind of advanced skills. And I would say that this is the thing that most parents report being glad they practiced ahead of time more than anything else. So let's talk about what that looks like to practice stretches. If you could actually do the stretches, your baby wouldn't need a procedure because it would mean they have the full range of motion. But there are some pieces of it that you can practice and you can get 85% of the process down. The main thing is getting better at getting your fingers under your baby's upper lip if they have a lip tie or if you think they might. Sometimes people are going to have the diagnosis and the treatment in the same day, in which case you can do this prehab leading up to your appointment, because if it turns out that your baby is not diagnosed with a tongue or a lip tie and they don't have treatment, there's no harm in doing this, and just doing this has therapeutic value because it helps babies to be more connected to their mouths and more in touch with how things move. So there's definitely no harm. In fact, doing this can sometimes help symptoms of tongue and lip tie get better. If your baby really does have a tongue and lip tie, it's not the solution, because as soon as you stop doing these exercises, all the symptoms are probably going to come back. But doing these ahead of time helps your baby be more ready for after the procedure if they have a procedure. And if they don't have a tie, could really help with symptoms getting better beforehand. Lots of therapeutic value no matter what. The main parts to this are getting under lip and under tongue and just getting as much mobility as possible. So our goal when we do lip stretches is to take the lip and lift it over the nose. When there's the lip tie, sometimes the lip can go almost over the nose. Generally, when we put the right tension in the right place, it doesn't, or they get red lines here or here when it does. But we can usually get pretty close with the lip, and it just depends on various factors with a lip tie. So the trick here is to go into from the corners of the mouth. When you do these stretches, you're going to have your baby like this. So their head is going to be towards you with their body away from you so that you're coming from above. And you're going to slide into the corners of their lips, slide along their gums until you're under their nose, and then pull out and up. And what that looks like is this. And my lip has lots of lift. I don't have a lip tie. My frenulum doesn't come down like between my teeth. Your babies may. You might be able to get it up, but their gums turn white. There's a lot of different ways that this can look. You might find that it's really hard to do. The main things to be practicing is sliding in from the corners of their mouth and you're trying to get your fingers so that they're like this. Okay, I can't really get my fingers turned around. Yeah. So they're going to come in and your fingers are trying to be here, basically kind of under each of your baby's nostrils and up as deeply under the lip as possible. So it looks like this, really up here, and then grabbing like this and stretching out and then going up as high as I can. That's a lip stretch. You would do that before all daytime feedings. You will be having to do some of this in the middle of the night for 2 weeks following the procedure. From there, it varies depending on healing patterns. Most people don't have to do things in the middle of the night after the first 2 weeks, but are still doing some things during the day for weeks 3 and 4. Most people are then done with these things by the end of week 4, but depending on the follow-ups that you have, again, if you're with the North Carolina Tongue Tie Center, you will have a follow-up at a month, at which point a decision will be made and you'll get guidance about how things shift. If you're seeing this video somehow and you're working with somebody different, then you'll have to see about their follow-ups and their recommendations. But typically you're going to be doing these things for at least 2 weeks with most providers. And if you are working with someone who doesn't really give you guidance on this, and there are a lot of resources and recommendations for different ways to do this, but that would be something to explore. So that's the lip stretch. And just before daytime feedings, you put your baby down. You can do this with, if you change their diaper before you feed them, you could put them down, change their diaper, do this, or do the lip stretch and then change their diaper if you want your hands cleaner. But kind of getting in there and doing that. When professionals are working with your baby, they will wear gloves. With your own baby, and especially in your own home, you don't need to wear gloves. If somehow that makes you much more comfortable, then it's fine, but they're not needed. So after the lip stretch, there's also the tongue stretch. The tongue stretch is the thing that people definitely struggle with the most. There's a lot of moving parts. It's a very small space. It's harder to get into. More than anything else, I recommend practicing getting your fingers under your baby's tongue and pushing their tongue back ahead of time. The timeline for this, a great time, is about 5 days before your appointment for treatment or for assessment and treatment. So if your appointment is on a Friday, you would say start on Sunday or Monday. But the tongue is, again, you're going to have your baby here. You're going to do the lip, lift their lip as far as it can, and then immediately go get your fingers under their tongue. When you try to get under their tongue, you want to come in from the sides and really get as deeply under their tongue. I would say something parents struggle with the most when they're first learning stretches is just how to get their fingers as deeply under the tongue as necessary to be able to really get good leverage for pushing it back in a way that is also as comfortable for their baby as possible. So practicing really getting deep under the tongue, you want to get as close to the base of the tongue as you can. You might be pushing on the floor of the mouth a little bit. That's fine. It's not going to cause any harm. It might make your baby drool a lot. The other thing that a lot of parents struggle with remembering to do in the beginning is to take their middle fingers and push down on the chin. If you don't push down on the chin, then when you push the tongue back, the whole head goes back. When a baby still has a tongue tie, the tongue can't usually go far enough back that it makes a huge difference. You can definitely see better, though, when you push on the chin, even before a tongue tie is released. But you're going to slide your fingers under the tongue and then push straight back. We're not lifting the tongue towards the roof of the mouth. We're pushing it straight back. So if this is the floor of the mouth and this is the tongue, you're trying to make the tongue go upside down. So you're trying to kind of get the tongue to point towards the throat. And what that means is that you're pushing it back. So you're taking the base of it here and you're pushing on this to push it back, and then the tip just goes with it. If you're trying to push on the tip, then it slides out like over and over again. But if you get deeply enough under there, then you really have the right angle to push back and be effective. But it can take some practice, and that's why practicing ahead of time before you're feeling a lot of pressure to get wound healing to be perfect, before your baby might be sore. And these exercises in their mouth can be irritating for babies that still have a suck reflex, babies who want to suck on your finger and you're not letting them, or a baby who's hungry, but instead of feeding them, you're doing something in their mouth. They can be irritating, but that's all, like diaper changes. However, if your baby is dealing with their mouth changing and they're feeling discombobulated by that, and they might have some soreness of the site or of sore muscles, which are much more common after the first day, if they're feeling soreness and they're integrating change and these stretches start at the same time, then they associate these stretches with something that has much bigger feelings for them. So if these stretches feel to the baby like they're happening ahead of time, then they don't associate them with their mouth changing, and they don't tend to have as big of a reaction to the stretches as they do if those start at the same time as their mouth changing. So for the tongue, slide in from the sides and then push down on the chin, and then try to push the tongue straight back towards the throat. And just take your time. Going too fast is one of the biggest mistakes that parents make, and it just makes the job harder. The analogy that I often use is if I'm in a big rush and I'm trying to text and I'm really hurrying, I make so many typos that I have to go back and fix that I probably send the text faster if I just slow down and I'm organized with my movements. So being organized with your movements is important. And by taking your time, you're communicating to your baby that this isn't urgent and they don't need to find it scary. That this is just a thing you're doing, that it could feel good. Talk them through it, speak slowly, keep your voice low, and that helps them understand that this is something that they don't need to be scared about. They're uncomfortable, but you're not escalating with them, and then it's fine. And most babies don't have that big of feelings about this tongue stretch if it's done before the procedure. So you're going to slide in, push back, push down like this. Now, if your baby has a tongue tie, their tongue probably won't go that far back. We're looking for the tongue to go that far back, and that will be your goal after the procedure. Before the procedure, sometimes the tongue goes this far, like that, or sometimes it only goes this far. There'll be a frenulum, that tissue that attaches the tongue to the floor of the mouth. That's going to be further forward on their tongue or shorter, because that's what makes a tie. A tie is that it restricts function by not allowing as much movement of the tongue as the tongue needs to function well. So function is the most important factor in the diagnosis. There are appearances that tend to be indicative of function, but the symptom list will be even more important. And your baby's tongue is not going to do all of the movement that it's supposed to, but what you're really wanting to do is get your fingers under the tongue well, push down on the chin, and then just go as far as you can. When you see that frenulum, that line of tissue between the tongue and the floor of the mouth, when you see it turn white, then you've gone as far as it's going to let you. So again, it's just under, down, back. And really get under, really. Don't be afraid to get your fingers way under there. You can practice this on yourself if you want to know what it feels like. If you want to have, I would say, because I had my tongue released as an adult and I did stretches on myself and I had other people do stretches on me, and I really took advantage of the opportunity to understand what it feels like. I will also say that I became aware of like which angle of my fingers meant my fingernails didn't feel pokey, things like that. So you can also practice, do this on yourself, have someone else do this on you, or do this on another adult or older child if it's going to help you to start to have a sense of what it should feel like before you're doing this with your baby who maybe can't communicate with you as much. But anything you can do to start practicing these is one of the most important processes to be doing in the week leading up to your appointment for treatment or assessment and potential treatment, because it makes a huge difference in post-op. The last thing to be doing in this prehab period, in the week leading up, is to be doing palate massage. Most people who have a tongue tie have a gag reflex that is further forward than it should be, because your tongue interacting with the roof of your mouth is what sets your gag reflex back at your soft palate where it should be. But a lot of people have a gag reflex that is moved forward and is on their hard palate, which means that getting a deep latch or swallowing with their whole tongue or getting their tongue up in the roof of their mouth at rest like it's supposed to be might not feel good, because that gag reflex is where it shouldn't be. We want them to be ready to hit the ground running and change what they're doing with their mouth as soon as they have that range of motion. So just massaging the roof of their mouth, just going in and going is really helpful to get that gag reflex where we want it to be. If you're not sure how far back the hard palate is, because you really want to go all the way to the back of the hard palate, where their gums end is where you're aiming. So you can just follow their gums around and then go across the roof of their mouth. So it's kind of hard to do from this angle with my finger, but just pretend my finger is facing like this, and you're going to go like, and I'm trying to get my whole hard palate. So all the way back here. A lot of people are just sort of doing the front of the mouth. And if your baby's able to eat at all, the front of their mouth is probably fine. You want to make sure you get the very, very back, and you get all the way to the back of where their palate is, or the roof of their mouth, and just follow their gums and then really get like all the way across the back. So if this is how their mouth opens, you follow their gums around and you want to go all the way across the very back of it, and then do that from each direction and go all the way across the very back of it. So tongue, lip lifts, pushing the tongue back, massaging the roof of your baby's mouth, doing this with every diaper change or before every daytime feeding for 5 to 7 days before your appointment is a really good idea. Those are the most important, but also noticing when you have the opportunity to help your baby work through discomfort and practice calming down through connection, where you're learning to help each other calm down and you're learning to support your baby and getting better at calming themselves down when they're frustrated. Those are some really valuable skills to do ahead of time. From there, also being prepared for discomfort that babies have the day of is very valuable. You'll get a ton of information on the day of your appointment as far as therapeutic tools and techniques for the week and weeks following the procedure. But if there are certain products that you want to have the day of or the day after, having those on hand ahead of time is much less stressful than trying to scramble and order things or get things overnighted or something like that. So again, you will have access to that information in the link for this in the description of this video. But just to go over some things, one of the most important things that you can do the day of the procedure following, when babies have their most sore period, is skin to skin contact. Research that's been done on skin to skin contact and neurology, what's happening with babies' nervous systems and brains while they are skin to skin, has shown that it takes about 6 hours for their nervous system to reset. So you're going to go in, you're going to have an appointment, you might be there for quite a while, you're all feeling pretty stressed out. We have every reason to believe that the procedure is not at all painful, but it is kind of scary and stressful. So we want to help babies reset. They're so resilient and they're going to be able to process this, integrate that experience, and move on through 6 hours of skin to skin contact. Some finer points to that. Skin to skin means from here to here on your baby. That means they're in just a diaper. It also means here on you. So think about the difference between a side hug and a front hug. Skin to skin, for the purposes of nervous system regulation, body temperature regulation, all of that, needs to be a front hug. It needs to be heart to heart like this, and it needs to be their skin on your skin. So your baby in just a diaper and them inside your shirt, or if you do wear a bra and it's like a thin one that just has like a little piece of material here, that should be fine, but I wouldn't go with like a shelf bra or something like that. You want as much skin here as possible. It doesn't mean you have to just sit and do skin to skin for 6 hours straight. You can have your baby in a carrier, as long as that carrier doesn't have anything between you and the baby. A wrap style carrier like a Moby wrap or a Tula works really well. Ergos and things like that can work. Anything that doesn't have something between you and the baby and just holds them here, you absolutely can be moving around and tending to other needs for yourself or your household while doing skin to skin. It also doesn't have to just be one person doing skin to skin. Anybody you trust to hold your baby can do skin to skin with them. Parents might shift, you might, grandparents, aunts and uncles, older siblings, everybody can take shifts in doing this. Moving from one person to another does not reset your 6 hour time clock. Doing a quick diaper change does not reset your 6 hour time clock. The goal is to not have more than 2 minutes of break in skin to skin in a 6 hour time frame. It's really helpful to plan for this, to have carriers on hand, to understand that you want to be home and doing skin to skin the evening of, to maybe plan for other household needs so that you can be doing that. If you have other children or pets or household needs that you can plan to delegate elsewhere for the evening of the procedure, that's really going to help you take this reset period and help everybody move on from that stressful day as quickly as possible. It takes 20 hours of skin to skin to reset an adult's nervous system. So you won't get the quality of reset that your baby will get from 6 hours because they're just that much more resilient than we are. But it is calming for everybody. And it turns out that we actually never lose the full therapeutic value of skin to skin contact, but it is the most potent in the first 6 months of life. And that would be for a full term baby. So, you would date accordingly for a baby that was preterm. So planning for that 6 hours of skin to skin contact is a really important thing to do. Some other products that people find helpful. Cold is very soothing the day of the procedure. If you have access to breast milk, that works really well. If you don't have access to breast milk, powdered formula tends to be a little bit grainy for this. And so I would recommend having some ready-made formula on hand, which isn't something a lot of people necessarily have, especially if their babies are a little bit older. But even you probably just need one bottle of ready-made. It's certainly a lot more expensive. But if your baby's old enough for solids, then you could potentially just use a tiny bit of water. but the either ready-made formula or breast milk works well for this. You can either have some very cold in the refrigerator, or you can even take some and put it into a baggie and freeze it in a flat sheet in the freezer. Just put it on top of something flat, and you can break off little chunks and put that under your baby's tongue. But cold feels really good the day of the procedure. After that day, we don't worry too much about that. Once the scab forms over the wound, which happens overnight for most people, then we don't have the same sensation for the wound itself, and it's not really necessary. But the day of, having some cold on hand is really helpful. Also, people will often want to have Tylenol or ibuprofen on hand. If your baby qualifies, if they're like old enough or whatever for ibuprofen, the recommendations on that can vary a little bit. So talk to a trusted pharmacist or pediatrician. But if your baby is old enough and qualifies for ibuprofen, we find that to be much more effective than Tylenol. Tylenol is certainly good enough the day of the procedure, but you might want to go ahead and have some of that on hand. Some people want to try other things besides Tylenol, or use Tylenol as a last resort. I have spoken to experts in homeopathy and some herbalists, and for homeopathy, the recommendation from homeopathic physician that I consulted is 30C or 30X arnica and hypericum. Those often come in little tablets. The recommendation for that was to put 5 of those tablets into an ounce of, for a baby, it would be milk. Typically, we wouldn't mix homeopathy with food, but we don't want to give babies under 6 months anything other than milk or formula. So you would mix it into milk or formula, about 1 ounce. So 1 ounce of milk or formula for a baby under 6 months old, water for someone older. You put 5 tablets of each of those in there, and then you just do 2.5 milliliters. It's a dropper full of, like, if you get the Tylenol syringe or you get a dropper, but you put a little bit in their mouth up to every 15 minutes. So when they're fussy, you do every 15 minutes. When they're less fussy, half hour, 1 hour. But the instructions for this are in that written document that I've mentioned a few times. And some links for options that can work well. For herbs, we kind of want to be specific. We have some unusual healing goals because we don't actually want to speed wound healing. We want to reduce inflammation, but we don't want to speed up wound healing. The other factor is we want to have as much tissue elasticity as possible. So some things that might be soothing also reduce tissue elasticity. Since the herbs that people use are often used after the first day, once we're really working on healing, we want to be mindful of those very specific healing goals that we have. And what that means is that we have a small number of things. The main thing that most people have used is slippery elm bark. Slippery elm has been used. The evidence we have is with mouth ulcers and stomach ulcers. This wound is not unlike an ulcer, and what's nice about slippery elm is that it coats. It doesn't really speed healing, but it does coat, and so it reduces discomfort without coating, and it doesn't reduce tissue elasticity like something like clove will reduce tissue elasticity. For babies, we want to make sure we're getting alcohol-free slippery elm bark extract. That is hard to find in most big like stores, or brick and mortar stores, but it's easy to find on Amazon. It'll be in glycerin. So if you search alcohol-free slippery elm bark extract, it's pretty easy to find. It's you just do a dropper, and you can do it right under the tongue. That is another thing that can be kept cold and used under the tongue the day of, and then with stretches afterwards, just for soothing. That was the biggest recommendation from the herbalist that I consulted with. And they also talked about turmeric being helpful, and then the arnica and chamomile can also be soothing. So there is one herbalist who makes something that was specifically made for this purpose, for using with babies. It's safe for all people. It can work for all people, but it's made with concentrations for babies that was specifically made for post tongue tie release. If you're ordering it ahead of time, you have time to order it, because it will not come as fast as many other things that are made by bigger companies. So ordering that ahead of time can be helpful. If you can't get that in time, than some of the other links, and that will all be laid out ahead of time. The last thing that some people have asked about are essential oils, and I also consulted with a certified aromatherapist. This is a very high level certification with aromatherapy, and you also have access to that information. But her recommendation for infants is not essential oils themselves, but hydrosols, which are also made in the process of creating essential oils, but are at a concentration safe for babies. And you will also have information there in that document that you can utilize. And hydrosols are water-based. They can also be kept cold. You can combine things. You can take a hydrosol, you can put the homeopathy into it. You can combine these things in a variety of ways. The biggest message that I want you to have ahead of time is to learn what your options are for comfort measures post-op, and see if there's anything you want to order ahead of time so that you have it on hand to use and aren't trying to find these things after the fact. Because what I've found is that a lot of people learn at the appointment about their options and then are trying to get these things and they don't have it that night when their baby is really the sorest and when it would be the most useful. So check that out. Absolutely consult with your baby's pediatrician, especially if there's anything that is new or unusual, and definitely if your baby has any health conditions aside from oral restrictions that you would want to talk to them about. If your baby's on medications or something like that, slippery elm bark interferes with the absorption of medications, and so that would be a contraindication. So there's lots of different needs and desires. Some people are going to be happy with just skin to skin and Tylenol. Some people are going to want to avoid Tylenol as much as possible and utilize these other more holistic options, or do all the things, and that's fine too. I think just deciding what you want to have for comfort measures, planning for your baby to need those comfort measures post-op until, usually 10 or 11 p.m. the day of the procedure is really helpful. The last thing that I want to talk about is leading up to the procedure, practicing any skills you want to work on ahead of time. One example is we often see people come in who want to breastfeed, but their baby hasn't been latching, maybe because it's been too painful and they've been breastfeeding and it's been painful and they were trying to let their nipples heal and they took a break from latching entirely, or they've been using a nipple shield all of the time but would like to stop using it post-op, or they would like to be using a slower flow bottle, but their baby really can't get enough to eat with a slower flow bottle, or maybe a different brand of bottle that is better for mouth engagement. So the most important thing is just to practice anything ahead of time that you can. If breastfeeding is too painful to do very much of, and so you've pretty much stopped doing it, start latching your baby after feedings. Give them the feeding the way you have been, the bottle or syringe or finger feeding, whatever you've been doing. Feed them and then latch them so that they're practicing latching, and it's something that is familiar to them when you want to do a lot more of it post-op. Anything that feels new to your baby that starts happening at the same time as their mouth changing is going to take longer to sell them on, because their mouth changing feels like a big deal. And anything we associate with change, we can eventually start to become comfortable with. But if you can introduce these things or reintroduce these things before the procedure, then your baby won't associate them with their mouth changing, and they're going to warm to them and get better at them faster. So practicing latching to the breast if you haven't been, trying latching without the nipple shield if you haven't been. This can be towards the end of feedings or after feedings or just for comfort. We don't have to start doing something that caused a lot of pain and wasn't healthy or a healthy balance beforehand, doing a little bit of it so it becomes familiar to your baby. Doing one bottle a day with a slower flow nipple, or top-ups or something like that with a slower flow bottle nipple. All of these are things that can be helpful so that your baby doesn't associate them with their mouth changing and take longer to get comfortable with these new ideas. And practice these things, and practice wearing your baby skin to skin. If that's not something you've done a lot of, skin to skin again always has therapeutic value, so you can practice doing it. One great tip that's also evidence-based is to have your baby skin to skin for a feeding, have them sleep on you skin to skin for one sleep cycle, that's 60 to 90 minutes, and then have them stay skin to skin for a feeding. So basically they're skin to skin from the beginning of one feeding to the end of the next feeding. This really helps seal pathways in their brain and integrate certain things. That would be a bit of a deep dive to say more about, but that's, you know, sort of a shorter window of skin to skin that can really have therapeutic value. But even half an hour after a bath, anything that works. Practicing skin to skin and getting good at wearing your baby and being functional while doing it is helpful in being less stressed out about how to navigate that post-op. Anything that can be familiar ahead of time to minimize the number of things that are new following the release of ties is really helpful in having a smooth recovery period. So that's really the big message, is start practicing things beforehand, have on-hand comfort measures for post-op that appeal to you, and make sure you have a good team, that you have an IBCLC, a manual therapist, aka body worker. Continuity of care really helps. Scheduling follow-ups for in the week following the procedure. Some people are hard to get in with, and getting those appointments could be a really good idea to do ahead of time also, you know, usually 5 to 7 days post-op, unless they have specific instructions for you, and then follow those instructions. But, you know, working with people ahead of time, having a team on hand that you can get a baseline with and follow up with in the week post-procedure provides a ton of comfort in just knowing. If you don't know who that is in your community, you can reach out. Social media certainly provides that. There are regional Facebook groups that help people find tongue tie savvy professionals of all different kinds in all of their places, and that can be really helpful as well. So in summary, practice ahead of time with anything you're going to be doing post-op. Most importantly, lifting your baby's tongue, or lifting your baby's lip and pushing back their tongue so that that becomes familiar to them. Have on hand ahead of time anything you're going to want for comfort post-procedure, and build out your team as much as possible to meet with people beforehand and plan to meet with them after, so that you have continuity of care for the whole team that you're going to be able to feel confident working with because they're tongue tie savvy. From there, as I said, if you're part of the North Carolina Tongue Tie Clinic, you will be given even more information the day of. You'll be given access to a ton of support. You'll be getting multiple follow-ups following the procedure, and you don't need to know everything. I know this sounds like a lot, but if you're doing these things, you're going to feel so much better when the time comes, and confident in moving forward that you're equipped to do this and that your baby is ready to go and dealing with their mouth changing, so that you can really hit the ground running and have as much success as possible. And we will be honored to work with you and support you. If you come up with any questions, write those down. Be ready to have any question you have answered, any concerns you have addressed. That is important too. But otherwise, we will see you then.